Hey, I'm Di McQueen, licensed clinical social worker, family and addiction expert. I'm here with Dr. Brian Jackson, my longtime cohort who specializes in the field of addiction. Welcome to Healing Families Shattered by Addiction.
Di and I have worked with addicts, alcoholics, and their families for over 30 years combined. Our podcast and coaching programs focus on families who have a loved one suffering from addiction. Our experience has been that this disease affects families as much, if not more, than the addict or alcoholic.
Is your world spinning out of control? Are you codependent? Are you experiencing worry, loss of sleep, and difficulty concentrating? If so, you're in the right place. Brian and I have both personally lived it, learned it, and now we're going to teach you tools and techniques on how to get your life back that you thought was shattered by addiction.
Okay, let's dive in. Hi, everybody. This is Dr. Brian Jackson with Healing Families Shattered by Addiction. I'm here with my partner, Miss Diane McQueen, licensed clinical social worker, master's level certified addiction professional, and an advanced accelerated resolution therapist. I always like to get all those credentials in. You got more letters behind your name than anybody I know.
Oh, you silly man.
Yeah, but in any event, we were chatting about different things, and there's so many different areas that we can explore and talk about and try and simplify and drill down for the family members in terms of ability to be able to cope faced with the situation of a loved one who is active in their substance use disorder, be it alcohol and or drugs. And for years, Di and I have heard, and the community has heard, that people need to hit their rock bottom before they will be willing to make a change. And I know I don't think that's necessary. I'm pretty sure Di doesn't think that's necessary. I mean, my definition of hitting rock bottom is when you stop digging. So there's definitely consequences along the way on the elevator down to your final rock bottom. And that's for family members who are trying to hang in there with the loved one and the consequences that they suffer, and also for the person who is active in addiction. And so how do we figure out, like, okay, we've gone down 2 floors, maybe we've gone down 2 floors, and our loved one lost their job. And so now we start financing them. And when I say lost their job because of their substance use disorder. So there's many opportunities along the way. This isn't like you just go from drinking and drugging to rock bottom. There's many floors, if you will, using the elevator analogy, for you to get off as a family member in terms of tying your wagon to the loved one and your happiness being contingent upon whether or not they are well or they are not well. And so how do you do that? How do you detach from them? How do you go on with your life without suffering consequences indirectly or directly as a result of substance use abuse or substance abuse in your family or for a loved one? And so Di and I had chatted about that and talked about that because it is so hard to do. It's upsetting. We want to fix people. We want them to be well. And if the alcoholic and addict is powerless over their illness until they decide to do something, think about how powerless you are as a family member trying to correct something as a third party that really isn't in the middle of it. I mean, you're in the middle of it, but you're not suffering from the disease. So I didn't know if you had any thoughts on that, but again, my definition of rock bottom is when you stop digging. You don't have to go to a place where you've lost everything.
And I happen to agree 100%. You and I always kind of joke around, and usually when we're talking to our family members or even our addicts and alcoholics, right? We always talk about soft landings. And, I'm a true believer that if we can slow the process down and educate, and frankly, all the studies do show that, when we don't change, we will not change until we are, ready. But also there are some form of consequences or some way that people stop saving us. So for a family member, it's super, super important to understand that there comes a point where, there's a difference between enabling and being supportive. And when you flip from that part of where you are making a conscious decision to support because someone is trying to better themselves and do something that is, valuable or viable for everyone's reward, then it makes sense, right? When you stop doing that and it starts to work against you, as Bry was saying, your elevator's down a couple of floors. Um, I love that analogy because the truth is we don't have to go back down to the bottom, right? But we do need to make some decisions that are best for us. And that means stepping out of some fear, maybe talking to somebody and recognizing, am I? Because I know when I was the family member or when I am the family member of those situations, it's always a little confusing as to what is helpful and what is hindering, right? What is enabling? What does that even mean? And, I know there's different definitions for different people. But for me, enabling becomes when I start feeling resentment about something that I'm doing, because I know it's actually not necessarily right. And I'm doing it more out of fear than I am out of, I really want to do this. It's probably a good opportunity for me to have, get honest with myself and really recognize what I'm talking about. So Bri brought up the, hey, someone lost their job. That's a great example, right? I'll help you. This may be a solution or a suggestion, right? Which is, let's sit down and make a plan of action and I will help you, provided you are doing X, Y, and Z. If you're not willing to do that, then I, family member, am not willing to help you, or I am, and if something changes, I get to make a decision. But when everybody knows what the requirements are and what the expectation from each other is, it's a lot clearer. Would you agree?
Yeah, I mean, the expectations for everybody is based on what you're doing, not on what you're saying.
Right.
So, if somebody loses their job as a result of their substance use disorder, manifesting itself in absenteeism or whatever it is, or being inappropriate, um, once we say, okay, we will support you until financially, without any acknowledgement of what the actual reason that this all happened for. And that's what really needs to be addressed. I mean,
Absolutely.
losing the job was second to the problem that created that, which is a substance use disorder.
Right.
So unless that person is willing to make choices and you have every right to be able to make a choice yourself as a family member,
Right.
not in a judgmental way, not in a bad way, but knowing that if you say, oh well, he can't be without money, uh, and not address the substance use disorder and give them money, you're basically co-signing, uh, I don't want to say their death certificate, but the certificate for them to continue the behavior. And it also sets off in the loved one's mind that, hey, if I get in trouble, they're going to bail me out. So therefore, I don't really have to take a look at this because mommy and daddy or wife or whoever is rescuing me. And when I say that, it's in
Exactly, which is the
quotation.
operative word, right? The rescuer, which of course it's very hard not to be the rescuer when you're scared, right? When you get into a fear or you know, a mode of anxiety or whatever it is that causes you to continue, or it's just easier, right? You think it's just easier than actually dealing with the problem. The facts are, and this is the research, it's not easier. It's actually harder in the long run, right? Because we've now trained them that that's acceptable and okay. I think Brian just hit it nailed on the head. Let's say, for example, they did lose their job and you are willing to help. The question would be, what are you doing to take care of this problem? I'm expecting you to go to IOP, and the person responds with, I'm not doing that. I'm not doing that. Then you have a choice to say, well, then I'm not helping you. And people go like all the time, I'm supposed to stay out of their recovery. I'm like, yeah, you're not necessarily supposed to ask them, exactly every day what their questions are about what they've been doing. But if you're supporting them, you have every right to know what their plan is. It's perfectly acceptable to do that.
Yeah, and it's kind of a double-edged sword, because you want to help them, you don't want to see them struggle, but if you give them money with no conditions as terms of addressing the elephant in the room or the problem, it also puts, I don't care how much money you have or you don't have. I mean, it's your money and it puts financial stress on you to support this person. And if they continue to drink and or drug, the likelihood that they're going to find another job, be able to maintain another job, are hell of a lot less than if you said, you know what, I'm willing to help you, but if you're not going to address your addiction problem, um, I can't help you. And so it takes away some choices for them. So the choice of somebody subsidizing that lifestyle has gone away. So now what do? They don't have money to buy drugs. They don't have money to go out and drink all the time, and they don't have a job. So, that could be a point where the person who is on their way to rock bottom says, okay, I'm going to get off the elevator here. I'm going to try and do something about this. So,
Right.
um, that's, and we're not saying to judge them or not love them, but you can love from a distance and realize that there are helpful things you can do, and there's some really unhealthy things that you can do. I have no issue with family members wanting to financially support recovery, be it on an inpatient, be it on an outpatient, be it on an individual counseling basis. I do have an issue with people just blindly writing checks because of a consequence caused by substance use abuse, um, just for the sake of keeping the person from experiencing the consequence of their actions. Um, and it's hard, but it's really important to remember it is the best thing to do. It is the most helpful thing to do. That old saying, it's going to hurt you more than it hurts, it's going to hurt me more than it hurts you, because it's hard to say no to people that you love in spite of whatever's going on. But saying no in this case would be actually saying yes to, I will support your recovery and help you in that fashion. And then from there, I mean, with my own kids, when they're doing the right thing and I can afford it and they want help, I'm more than happy to do it. But I am not going to give them money to perpetuate unhealthy, toxic, detrimental lifestyles.
Exactly. And there's another thing that comes to my mind, B, which is, a lot of times we do a lot of these things based on guilt, right? Because a lot of parents, especially this parent-child relationship, which is, somehow I'm the one that caused this to happen. And then the guilt starts, right? And as the guilt starts to go into play, we start to become less able to think clearly about what to do and what not to do. And in those cases, I really think it's important that somebody gets some help, because it's hard as a parent, that loves and their child's in trouble. And I hear it all the time from people. It's different than a husband, or it's different than, a parent or whatever. I go, well, again, having had all the above, I'm not sure it's so different. I think it's a lot of feeling, but if in your mindset it's different, then you're going to end up doing some things that are really, really harmful, potentially to yourself and other relationships you might have. You have other children, they're not getting that same attention, right? You have a
Mm-hmm.
husband or a wife, they're not getting that same attention. And in fact, that's your healthiest relationship, right? The most important one, the one with yourself first. And then the second one is with your partner or husband, wife, whatever. Then your children. We didn't know that. I certainly didn't know that that was the way healthy relationships work. I go, that doesn't mean that someone doesn't come to the surface from time to time where they need a little more attention. But to do only things out of guilt is not a good reason to do them without some guidance on how to construct this properly. And that's where you go getting some help, going to an Al-Anon meeting that might, help you kind of see things a little more clearly. It's hard to see, the forest through the trees, so to speak. And so I think it's really important that we're clear on the reasons why we're doing that. Because if I can understand myself, I have a much greater chance of being firm in my decisions based on, something other than letting a feeling drive us. And a lot of us do that, right? Where we let the feelings drive our decisions and choices, even though they become detrimental to us. And as Bryce said, we also, as family members, we can choose to have our happiness contingent on someone else, or we can choose to have it based on what I'm willing to do and how far I'm willing to go. Because somebody else is having a hard time does not mean I have to completely fall apart as well. But I think a lot of times and I certainly know I thought so. I thought so. I didn't know any better. I didn't know what to do. And so as I learned skill sets and tools to do that, detachment being one of them, I think Bry mentioned that earlier, which is, it's a work in process. You have to work on understanding what the meaning of detaching, which is I can still love somebody and not like their behavior and set boundaries around the behavior. That was a whole new concept for me. Thoughts, B?
Well, yeah, I mean, when there's a problem, there is always a solution. So if we pull our head out of the emotional attachment, the loss of a job is a result of substance use. Okay, that's a problem. Um, okay, do we fund this and keep this thing going until they have the next consequence? Could be something legal, like a DUI.
Mm-hmm.
So, my experience and your experience has been, when people drink and drug, they don't always get in trouble. But if they continue to stay on that path of abuse of whatever their substance of choice is, but the consequences are multiple as time goes by. You start with a job loss, then maybe you have a DUI, then maybe you have a divorce, then maybe you have child custody issues. So the point is, you have to seize the opportunity where the person is maybe out of denial a little bit, like, instead of saying, I lost my job because they don't like me. Well, let's delve a little deeper into that. What did they say the reason was? The reason was, well, you haven't shown up, you haven't called, no call, no show, or, leaving early or arriving on the job impaired. You know, if that's obvious to the person that's using, then there's the problem and we can work on a solution. But if you fund it, you're going to continue to help them cover it up and be in denial, like, okay, this is just a blip on the radar. That has nothing to do with my drinking or drugging. And we'll just act as if, everything's fine.
Right. And there's also the family member. Let's flip to the other side of that. The family member that loses their job because they can't stay focused enough and they're always leaving work to go rescue this person. Um, Even though, let's say, they're not funding them, but they're always going to do something for them or pick them up somewhere or do this or do that because they're so emotionally intertwined with them and trying so hard to keep them from doing whatever it is, and they end up losing their job, right? Because the same things, we can go to those bottoms, the same kind of bottoms, without taking a drink or drug if we are so emotionally intertwined with this particular person, because that's what we end up doing at times. So, there's a bigger and broader scope to this than just the one thing that Bryce bringing up the greatest example, and it is tended to be funding, but it can be a lot bigger than that. And it can also be on our side of the street, the family side, where I say our side, because I refer back to sometimes when I was the family side. And it's very difficult, right? How many times I would drop everything I was doing in my day because, this person may have had a moment of clarity, or, I needed to go take them somewhere because I didn't want them driving the car, or whatever it was that we choose to do. So I want viewers to kind of think a little broader than just okay, well, that's never happened to me, because that's what we do, right? Oh, well, my kid hasn't really ever lost a job, or my spouse, or whatever, or they haven't had a legal problem yet, or they haven't had a health issue yet. Or there's another example: how many times you have to stop work or your life because they're in the hospital again because they OD'd, they had a heart attack, they had, whatever in relation to a substance use disorder. And so, these things do affect us in a big, big, big way. And we have to sort of figure out, where is our lines on what we're willing to do to stop affecting our life so dramatically. And lots of tools and techniques, tremendous amount of tools and techniques.
Yeah, it's amazing the lengths that as family members we will go to not really look at this in the seriousness that it is, like with the hope that, okay, this consequence this time will be the wake up call for them and maybe they'll just stop. And,
Right.
it's, and then it becomes fragmented thinking, it's like on a daily basis, is the phone going to ring? Who's going to be coming through the front door? What kind of drama or 911 is going to happen? And so if you're fragmented like that in terms of your thinking, how can you fully concentrate on your primary other relationships, your job, yourself, most importantly, like taking
Right.
care of yourself? Like maybe all of a sudden you stop going to the gym because it's just things that you used to enjoy are put on the back burner because this thing is, they're powerless over it. Think about how powerless we are over this illness as family members. And, it's easy for us to say, and we understand, and I understand, Di understands emotionally as a family member of somebody with an addiction, that it really is important to talk to somebody that knows what the heck they're talking about. And the goal there is to not distance yourself from that person in a judgmental way. But some of the
Exactly.
actions that you take that are out of the ordinary compared to the way you used to react, like, oh, I'm going to rescue them, I'm going to save them, I'm going to support them, and hope that it all gets better. There are actions that you can take that may be an aha moment for the person who's suffering, saying, wow, they're not coming to bail me out of jail anymore. What's up with that? They're not sending me money anymore. What's up with that?
Right.
But those are some of the best decisions you can make, acts of love, even though emotionally it's difficult. We think that we need to go help our loved ones when they're in danger. But this is an illness. They're not bad people trying to become good people. I talk about that all the time. They're sick and we want to help them get well and stay well. And so it's an all-encompassing process. And the family definitely has to be a part of it in terms of their healing in order to support the person's healing. Don't want to get sucked into the illness. Not that you're going to start drinking or drugging, but all the side effects and byproducts of somebody in addiction can spill over into your life. And all of a sudden, one day you'll be like, oh my goodness, I am not happy. I am not happy.
Right.
Um, Things have really changed for me. I don't have much of a life other than my happiness being contingent upon this person getting well. Tough place to be.
It's a rough place to be. And it was like it was yesterday, but I remember thinking, like I didn't go out with friends anymore. I wasn't doing any of the things that I loved. It was like this hyper focus on somebody and trying to, understand where they were, what was going on, and, feeling so out of control. And so, again, those are the kinds of behavioral things we're talking about, right? Which is you don't have to give all that up. And when I learned to not, boy, the person didn't change. I did. And I was able to see things very differently and live my life and go out and do things with other people and, go out and enjoy the things that I love to do while still trying to help them, and being very clear on what that looked like for me. And, you as a family member can do it too. The yelling, the screaming, all of that stuff can stop when you understand where you are and your powerlessness over that, just understanding what you're willing to do and what you're not willing to do. They don't have to do what we ask. They don't. But then I don't have to do what I'm, offering to do either. And that's where the bottom line comes down to. And it's a very hard thing to do. Um, Not knowing where the outcome is going to end. And I think that's where a lot of us get caught up is I don't know where if I had a crystal ball and I could see that they'd be okay, they may not be okay. And I have to come to an acceptance of that as well. And I think that's where, once you start to really get that and understand how powerless you are, but how manageable your life can be, even though you are powerless over what another person is doing or choosing to do, boy, is that powerful. And it's really I'm telling you, I'm a different person today and I don't worry about those things. I really do spend most of my time knowing, what I'm willing to do, what I'm not willing to do, and that I don't have to have, my life is not good or bad because of somebody else's. That doesn't mean I never have a bad day because of somebody, because, as the classic consummate codependent and acknowledge that I still have to really ask myself questions, but I also have a network of people who can help me, right? and who I I'll talk to about these things and ask, am I being too generous? Am I being too kind? Am I not setting enough boundaries? Am I doing something detrimental to me? And they will tell me, yes, you are. No, you're not. That sounds like a great idea. And I think it's super important that we know that. I still go to Al-Anon meetings, believe it or not, after all these years. But I love it. It's my medicine, just like, any one of our 12-step programs, which we all go to. And those are all great things. But we all need our network. We need our support. We need to understand, am I thinking clearly? Because we're great. I'm a master at going into denial when I want to. So I need my people around me to kind of go, hey, wake up, girl. Gently, they will bring me back without judging me, because it's hard to do these things when you love and care about people. And so it's important to have a few people in your corner to be able to know how to address you in a way that will make you think about what it is you're doing and just question.
Yeah, and I think that, in spite of what we're saying, I mean, we're making, I don't want the audience to feel like we're making assumptions. I mean, you don't know what you don't know. And so, I mean, Di and I have had a lot of practice in this field in terms of dealing with families. And so it's hard for you to come up with a solution that's healthy for yourself and for your loved one, really without any direction from quote unquote experts that have, do this all day, every day. So my strong suggestion would be, if you find yourself that you're in this position, that you're kind of stuck, you don't know what to do, you really don't have, a network of people that have experience with this, that you, go to our website and sign up for a free consultation. And we'll be with you for 30 minutes and find out what's going on. And we'll let you know whether or not we think that we can be of assistance, or if we can't. I mean, it'd be unusual that we couldn't, if we're talking about, families and substance use and what it does to the person and to the family. So the most important thing to realize is that there is help out there. There is a solution. You're not alone. And we understand, which a lot of times we feel like we're terminally unique and we've got to hide this from other people. And, what do I do? What do I don't do? And so, we don't expect you to have all the answers for something that's really out of your area of expertise, but we can give you a lot of good direction, and hopefully, and we don't tell you what to do, but make strong suggestions. And then when you apply them to your life, you will see changes. So there isn't just one way to do this.
Exactly. Thanks, B.
Yeah, thank you, Di. And I think it was a great topic. If anybody has any questions, you can email us at info@familyandaddictionexperts.com. We will get back to you on our website, which is www.familyandaddictionexperts. We have a family survival kit resource on there where you can download some PDFs that at no charge, that can be helpful in terms of topics related to this that we're talking about today. So as always, we wish you all the very best, and you'll hear from us probably in a couple of weeks.
All right. Thanks. Thanks so much for joining our podcast, Healing Families Shattered by Addiction. We'll be back in a couple of weeks with more important tools, techniques, and ways for you to focus on you instead of the alcoholic or addict in your world.
Until then, please go to our website, familyandaddictionexperts.com. That's familyandaddictionexperts.com. You'll also see links to our Facebook and Instagram pages. Please also, if you have any emails that you would like to send us, that's info@familyandaddictionexperts.com. That's info@familyandaddictionexperts.com. With any thoughts, feelings, questions that you may have for us, we would love to hear from you, and we look forward to seeing you in a couple of weeks.